Everybody, welcome to an updated sort of recap of what's going on with my hip post hip replacement. If you've followed along my journey, you know that it has not been an easy one. And a couple weeks ago, I let you know that I was going to see a specialist who deals with complex infections of major joints. And he did some testing, and I'm getting the results back little by little, but there's still some more testing to do. And so all of this has brought to my attention again how we have to do a better job as human beings, each of us with our own struggles, of listening to each other. My medical team is amazing. I'm not talking about the doctors, I'm talking about humanity in general. And the thing that has come to my attention the most in the last, I don't know, 2 months or so, since I really started turning a corner that wasn't in the right direction, is I have gone back to work. I took 5 months off from my hip replacement and then my revision. I took 5 months off to heal. And I started to go back into work in June and July at 50%. And I'm still at 50%. And it feels really healthy to me and it feels really good. And so I feel like there's a lot of feedback that people give me and probably other people that isn't necessarily invited, but because we live in a world where everybody gets to share their opinion and write a review and blah, 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 we have a tendency to just blurt things out at people that is so insensitive. And so about end of July, early August, I took a turn in the not good way with my hip. I started in what felt like congestion. It felt not tight, not crunchy, just congested. And so went through August feeling though as the weeks went by, it was feeling more congested, more full, had a familiar feeling of fluid that I didn't like because that's how it felt before. And so I went back to my physical therapist. And from the month of September, I saw her every Monday. And from the first Monday in September to the end of September, I had lost anywhere from 70 to 80% range of motion. I had less mobility, less flexibility, less ability to do things, simple things like tie my own shoes, because there wasn't any room for my femur head to posteriorly drop. So anytime I go forward, there's no room there. So I have an immediate pain. So we started to just be thinking, like, what could this be? What could be going on? So I went to see the specialist who deals with these complex reinfections and infections of joints. And he ran some preliminary tests. Now, the preliminary infectious test looking for bacteria was negative. And part of me is like, that's good. I don't want an infection. But if I don't have an infection, why is there so much fluid and why is it so painful and full? So we did an MRI. The joint capsule is not fully closed, which would indicate the synovial fluid causing some of that gush into my, what I call my white pumpkin, because it literally looks like one of those white pumpkins on the side of my hip. So the MRI shows a lot of stuff, a lot of inflammation, a lot of fluid that shouldn't be there. But then what's the solution? Well, through this, I've learned to really advocate for myself. And I know that when I grew the bacteria before, the culture did not show anything growing until about the 2.5 week mark. So I asked the doctor if we could do another aspiration, another culture, and let it sit for 3 weeks. If the 3 week point comes and nothing has grown, then we kind of look at, do I live with this level of pain and limitation? Or do I take a gamble and remove the hip, which is a huge gamble? Now, if it's infected, there's no choice. It has to come out. And so, as I've been faced with this for the last month, this conversation has been had for a month, and the testing and the results. The feedback that I get from people who I'm not necessarily inviting their feedback, is things like, well, it must not hurt that bad because you're working. It must not hurt that bad because I see you walking. It must not hurt that bad because you're still doing everything. Well, two answers to that. One, I agreed to do it. I'm committed to do it. I have an agreement with the yoga students that I choose to serve that live in horrific conditions. I signed up for that. And until I can't, I'm going to do it. End of discussion. And then the second thing is I have to work. I have to work to provide for myself. I have to work because it's what I do. It's it's my integrity. And so for people to just sit on the outside and look into my life and tell me that I must not hurt that bad because I'm still showing up for life is so insensitive. And and what I've really come to realize is that each individual that is going through anything hard, emotional, spiritual, physical, we are all going to cope differently. And the way that somebody copes is nobody's business. And for me, I have coped my entire life by being productive. When things are hard, I get stuff done. When I'm anxious, I get stuff done. When I'm in physical pain, I get stuff done. I produce, I'm creative, I work, I serve, I give, I mow the lawn. Well, I didn't this year. Um, I just do things. There's a million things I could do, and that's how I cope. Some people cope by sitting and thinking about it and worrying about it. Some people cope by sleeping. Some people cope by eating, by drinking, by exercising, by online shopping. Like, there's a million ways that people cope. But how I cope is by being active and being physical to the limits that I can, which means I'm lifting weights when I can, I'm walking when I can, I'm in the water when I can, and I'm working because that is my coping strategy. That helps me stay centered. It helps me stay grounded. It helps me be my best self. And there's nobody's business of how I cope. And so I go back to, and I talked about this before, but I go back to that beautiful Brene Brown teaching that came from that famous Theodore Roosevelt quote about being face down in the arena. And I think about this all the time. I think about my life is on the field, and there are 10,000 spectators watching my life on the field. And I'm stumbling and I'm falling and I'm getting back up, and 10,000 spectators are watching me. There are a handful of people that have earned the box seat position where they have earned the right to look at my life on the field and give me feedback. Handful. The other 10,000 minus five ish people that are watching my life, those are the cheap seats. They didn't pay anything to watch me in my life. They didn't earn that right. They're just showing up and they're just watching. Now, I have to really remember that when my resiliency is low. And this last 2 weeks, my resiliency to tolerate stupidity has been really low. I've lost my temper more than I haven't, it seems. I find myself being irritable and frustrated with anybody. And that's not in alignment with who I am. Who I am is centered and grounded and grateful and forward thinking. And so when I find myself getting out of that alignment and reacting to things or being triggered easily by things I have no control over, I know I need to check in. And the way that I check in is stopping for a second and really asking myself, what is the root of what's bothering me? And what is the root of what's bothering me is that I have uncertainty. I don't know what's going to happen with my hip. I don't know if I will ever be pain free. I don't know that I will ever heal. I have a lot of complicated things going on in my body that is impacting my ability to heal. So the uncertainty, not the stupidity, is what's taking me out of alignment. And so I need to do things that will bring certainty. And what will bring certainty to me is what I can control. And what I can control is my work, what I can produce, what I can show up with to serve people, how I take care of my body is in my control, how I self care is in my control, who I surround myself with is in my control. And those are the things that keep my life on the field good. Because lose that resiliency and I lose that certainty and I fall into that trap, that's when the stupidity irritates me. And I hardly ever get irritated by stupidity. It is what it is, right? So my my point in this update is to check in with yourself if you're struggling. Figure out what's the root of your struggle. Is it fear? Is it uncertainty? Is it pain? Is it grief? I'm there. I'm there. And then how can you cope with that feeling? How can you cope with that grief and uncertainty and pain? I cope by being busy. I cope by working, by being productive. Work meaning anything, baking, making body butter, making videos, teaching yoga, whatever I can do that's in my realm of control, which is good for me, that's what I'm going to do to cope. Now, we have to remember that it's nobody's business how you cope. If you cope by sleeping, that's okay. That's how you cope. And that's what you need. So figure out who is in the box seats of your arena, the ones that have paid top dollar to give you feedback, to be in your life. Focus on them. And the cheap seats, they're in the nosebleeds. They don't matter. And figure out what you need, because it's hard and you need to figure out what you need to stay yourself and to stay true to you and stay to truly aligned with being your best self. I pride myself on being an incredibly loving person, but in the last 2 weeks when I'm flying off the handle, it's not loving. And I know, like, okay, I got to check in. I got to figure out what is the root of this, which is the uncertainty, and then cope with it by doing things that I have control over. All right. So 3 weeks from now ish, I will be getting my aspiration results and a plan forward. I do great when there's a plan. So knowing that the timeline is in place, things are happening, will give me direction. And then in 3 weeks, I will have an answer and I will update you then. If I have any more insightful things that occur between now and 3 weeks, I'll definitely pop on. But in the meantime, be a better listener. Listen to yourself, listen to other people. Don't compare your journey to anybody's ever. Don't blame, don't shame, and find something to be grateful for. All right, that's what I got for you. Take care, and I'll see you soon. Bye.